No, it's not. The advice we have is the health system is strong and ready, but the problem is the rollout of the third dose. So all the advice we have is the third dose makes people's resistance to Omicron stronger. It also makes people have a higher survival rate from Omicron, and we're currently only at about 25% third dose. And so we need to roll out more third doses. We also need to provide the opportunity for children to get vaccinated. As you know, they only became eligible on December 10. The third dose rollout only started, I think, in December across Australia, so it's only very new. And a lot of people aren't eligible for the third dose yet. It's not exactly fair to say to a bunch of people, we're going to introduce Omicron deliberately into Western Australia, and you haven't been eligible to get your third dose because you only got your first two doses at a certain point, and it requires four months before you can get your third dose. So we have to get the third dose rate up. But we have expanded hospital capacity, bed capacity, staffing capacity significantly in a very challenging environment, I might add, certainly in terms of attracting staff. And we have the equivalent over the course of perhaps last year and towards the middle of this year of adding 520 new hospital beds into the system, which is the equivalent of a full tertiary hospital. But it's about basically, and I think everyone would understand this, watching what has occurred over East and making sure that when it comes to vaccination, we're as ready as we can possibly be.
Premier, up to what? What do you want those up to?
Well, the aim is to get it up above at least 80%, perhaps 90%, but what we're going to do is review the situation over February and watch what is occurring over East and work out what the best approach is for Western Australia. As I said in my address, it's very disappointing for lots of people. Lots of people have booked holidays, flights and the like. Very disappointing and very hard for those people and families. Hard for some businesses, but if you have a look at the alternative, which is what is going on in the eastern states at the moment, they basically have hundreds of people dying. They have mass dislocation of the economy and logistics and freight and all elements of the economy. Huge numbers of people not going to work, kids not going to school, hospitals overflowing with patients, hospitals in meltdown. That's what's happening. And it would be grossly irresponsible of me not to watch and act on the basis of that because to do anything else basically would mean that we'd be responsible for, without high levels of vaccination, potentially lots of people dying.
What about when the next comes along, Premier? Do we know that a third dose is going to be enough then?
Predict what the future will hold, and we couldn't predict Omicron. Omicron came along on December 8 into Australia. The initial advice we got on Omicron was that it was far less serious than Delta, far less lethal. So it actually sounded comparatively pretty good. What we've found over East is hospitalisations since Omicron arrived have gone up 900%. And in the course of the last 19 days, nearly 700 people have died over East. Nearly 700. So it's obviously a very serious situation and one we're going to do our best to try and avoid and/or, if can't avoid it, ameliorate it as much as we can here in WA.
How many weeks or months is it going to take to get to 80 or 90% triple dose vaccination?
Well, our expectation is that by February 5, we should be at around 35 to 38%. And obviously after that it climbs as people become eligible. I can't give you an exact date as to when we get to 80 or 90%, but that will take some time.
At the moment, ATAGI won't even allow, get me right here, but I know sort of 17-year-olds, anyone under 18 can't have a third dose, so we are dependent on that, aren't we?
Well, that will be one of the subjects that we review. So over February we'll conduct a review and look at all these aspects with the latest information of what comes out of the East, because, we can watch what's occurring over there and we can learn from them. And we've been learning from them. The biggest learning I've had out of watching what's going on in the eastern states is we've got to try our best to avoid that. Now, we are in the unique position. We're the only place in Australia that doesn't have a large number of COVID cases. Over the course of the pandemic, in Western Australia, we've had one person acquire the virus here and pass away. Over east, New South Wales and Victoria, it's hundreds, if not thousands. So let's just take a deep breath, acknowledge that it's very difficult over there, and we've got to do our best to avoid that occurring here.
Immunity will wear off for people